So natural sources of iron are divided into three. One is the best ones that come under good sources, and the ones that come under very poor sources, basically useless sources. So when I say the best sources, it includes meat. Meat can be from any source, it can be from any animal. Apart from that, fish. Apart from that, you're also going to have egg yolk. And finally, a bit of vegetarians को थोड़ा बहुत beans. Good sources includes leafy vegetables. I have cereals. I have ragi. I also have dates. And for poor sources, I have milk-based products. Now, you would ask me कि khajur is date by the way. So khajur to जाने दो. Problem is khajur, which is date, is very expensive. So not all women, especially in our country where women come from low socioeconomic status, not all women can afford that. So let us think about one question that you're going to be asked in your exam. And that question happens to be jaggery. A lot of examiners love asking this question कि jaggery क्यों नहीं बताते हो तुम लोग? Jaggery बताओ as a very good source of iron, especially in our country where jaggery is fortified with iron. I will never mention, I personally will never mention, neither to my patients nor to my examiners, jaggery as an answer for a good source of iron. The reason is the amount of jaggery that is required to be consumed, to be able to provide with that adequate required amount of iron per day during pregnancy or even a non-pregnant state is too high. If you're consuming that much of an amount of jaggery, especially during pregnancy when there is going to be an insulin resistance in the second and third trimester, physiological insulin resistance, you're giving rise to that female having gestational diabetes mellitus. So a comorbidity में you're giving her another much more dangerous comorbidity, which is why jaggery can never be the answer. One possible answer is cooking in iron utensils, बट यू ऑल्सो नीड टू रिमेम्बर कि इंडिया में आयन यूटेंसिल्स जो यूज होते हैं, इंडिया छोड़ो कहीं पे भी अगर यूज करते हो, देयर कैन बी ऑक्साइड्स, फेरस ऑक्साइड, फेरिक ऑक्साइड, ये सब उसके कंपाउंड्स बन सकते हैं विच कैन बी इवन टॉक्सिक टू पीपल, विच इज व्हाई I would want to prefer not using just iron utensils and cooking in iron utensils, especially in India, I said, because India में जो iron utensils मिलते हैं, they are not purely iron. They also contain other metals, and those other metals are added to it to be able to sustain that temperatures, high temperatures. So उसके जो toxic radicals बन सकते हैं because of heating food in it, they can be deleterious, they can be very bad, detrimental for a female or any human health, which is why cooking in iron utensils is a good way to know. But given the fact that the government gives us iron and folic acids for free, tablets for free, I wouldn't want to risk that female towards the development of the toxicity by that. Fine. So you would ask me, कि ठीक है, what if it's a female who is having a mixed diet, she's eating well enough, good enough amounts of non-veg diet, and I can just supplement her with a lot of non-vegetarian diet. Remember, non-vegetarian diet can also lead to hypertriglyceridemia, basically dyslipidemia, fats बहुत होते हैं. And to also make it palatable, there's a lot of other spices, oil, and a lot of products that are added to it, which though it can be made palatable, it can be again deleterious from a dyslipidemia point of view. You would ask me कि उसको good sources बढ़ाओ, but then good sources में कितना खाऊंगा? How much can a female have leafy vegetables? कितना cereals खाओगे? और उसमें जो बाकी के side effects आएंगे, amino acid deficiencies आएंगे, they cannot be supplemented, which is why increasing the natural sources of iron as a way to supplement iron is not a great way. Still, if you tell me कि मैंने कैसे तो manage कर लिया, I have made a good enough diet chart for this female, and I believe that should be adequate for her to be able to supplement her daily needs. Let us understand why even that is not the best way ahead. The reason is that ये सबका मैं बेस्ट कॉम्बिनेशन भी खा लूं ना, मेरा डेली जो कंजम्पशन होने वाला है, जो मेरा डेली डाइट आने वाला है, दिस डेली डाइट will still just contain around 10 to 20 milligram of elemental iron. We speak of iron in terms of elemental iron कितना है. So elemental iron इसमें सिर्फ 10 to 20 milligram आने वाला है. ठीक है, 10 to 20 milligram. What is the daily recommended allowance in pregnancy? The daily recommended allowance in pregnancy happens to be 6 to 7 milligrams of elemental iron per day. So you would say यहाँ पे तो 10 to 20% मिल रहा है, that's an excellent thing, but you need to understand that when you are giving it through the oral route, not all is going to be absorbed, a lot of is going to be wasted, a lot, इतना lot कि 90% is wasted and only 10% is absorbed. So when I say 10%, it is only 1 to 2 milligram of elemental iron that is going to be absorbed, and 1 to 2 milligram is too low in comparison to the recommended daily allowance in pregnancy and lactation states, which is also why Anemia Mukt Bharat, which is a program that is formulated by the government for the correction of anemia in adolescents and reproductive age women and pregnant and lactating women. Basically, a program that has been more focused on women and children and adolescents to reduce the rates of anemia in our country. The tablets that they provide for free, those tablets which come in two forms, a red tablet and a blue tablet. Both of them contain 60 milligram of elemental iron, because they understand कि 60 मिलीग्राम का जब 10% एब्जॉर्ब होगा तो 6 मिलीग्राम एब्जॉर्ब होगा, एंड 6 मिलीग्राम अगर एब्जॉर्ब हो रहा है दैट इज गोइंग टू बी एडिक्वेट फॉर मी in terms of my recommended daily allowance, and hence the pregnancy का जितना भी demand है is going to be sufficed. This is a very easy way to remember. The older guidelines said कि 100 milligram elemental iron देना चाहिए, but नहीं, the current guidelines say कि 60 milligram of elemental iron is sufficient enough for a female to be able to maintain her hemoglobin in the normal level, which is why 60 milligram elemental iron is present in both these capsules, red and blue. You would ask me, तो अलग अलग दो कैप्सूल क्यों बनाने हैं, दोनों के अंदर सेम है ना, 60 milligram elemental iron with 500 microgram of folic acid. What is the difference? Why do I have two different tablets? I could have just made it red now, because red is for reproductive age women and pregnant women and lactating women, whereas blue is for adolescents. You would still say कि मैं adolescents को क्यों ना दूं? It is because there can be a social stigma that my daughter, who is a 16-year-old in especially tribal and village areas, they would say that a female who is pregnant in the village is also taking a red capsule, and a girl who is an adolescent 16-year-old, she is also getting the same capsule red color ka. That stigmata might make them into thinking that that adolescent girl is getting an overdose because she is not pregnant, and say though they may not end up giving her. Plus, red color justifies menstruation, pregnancy, lactating states, which is why this has been kept as a stigma prevent करने के लिए, and so that adolescents do not end up thinking कि मुझे pregnancy के औरत वाला चीजें दिया जा रहा है. They do not know the doses inside that. They just know कि ये मुझे गोली लेनी है, which is why blue capsule is given to adolescents. It is given once a week, by the way. We'll be talking about this later, but still once a week, whereas जो red वाला capsule है reproductive age, ये तीनों को जो दिया जाता है once per day दिया जाता है in a normal female, and twice per day in a female who already has iron deficiency anemia. So that is the logic behind Anemia Mukt Bharat का जो 60 milligram elemental iron है उसके साथ 500 milligram folic acid है. But this is the logic behind why we give supplement of iron. We give it in the form of tablets, we give it in the form of capsules, and why we do not rely purely on the basis of just diet.